So what is the Bioclear method? Well, in 2007, I'd been practicing for about 20 years using an operating microscope to do all of my dentistry. I was looking at things with an incredible amount of magnification. And basically, we had two worlds. We were able to restore a tooth with bonding, which was done by hand, and it didn't seem to be very temporary, and we didn't have the ability to rejuvenate a tooth. And then we had porcelain veneers and crowns. And I loved doing porcelain veneers and crowns, but year after year, I would see the devastation from grinding a tooth down so much. And so later on, some of these teeth needed root canals, and after you do a root canal through a crown, the tooth can break off. And so after a decade or two, you start to get some perspective. And so we wanted to have a third place. We wanted to be able to rejuvenate a tooth without the need to amputate so much tooth structure. So we developed the Bioclear method. And so first things first, we developed a matrix. These are super thin anatomic forms. They're as thin as a human hair, only about 50 or 75 microns. And so we gently prepare the tooth by removing all of the biofilm so we get good adhesion to the tooth. And then we wrap the tooth with these special forms, and then we inject this white composite material. And it's an incredible material produced by 3M. These composites are used now to build jet airplanes. So the material can be very, very strong when it's injection molded. So what have we built? We built a third place. We had bonding, which was relatively inexpensive, low physiologic cost, but it didn't hold up very well, and it couldn't rejuvenate a tooth. And then we had porcelain crowns and veneers that were beautiful and strong, but at a high biologic cost. Bioclear allows us really the best of both worlds. Super conservative. We can injection mold the material around the tooth and preserve essentially all the tooth and make the tooth stronger, remove black triangles and areas where the tooth is deficient or diseased, and have one beautiful monolithic mass that's solid and sparkly, making the tooth a little bit thicker, ensconcing the tooth to make it disease resistant, resistant to stain, rejuvenating, making the tooth younger without grinding the tooth down. So what do we have? We have a third place, and that's the Bioclear method.